Medicare Advantage and Medicare Supplement plans are two solutions that attempt to address some of the gaps of original Medicare. But that's where the similarities end. Unfortunately, Medicare is complicated, and Medicare Advantage plans and Medicare Supplement plans are really entirely different. But sometimes people find themselves enrolled in a Medicare Advantage plan because they are marketed more heavily. Sometimes those commissions are a little bit higher, so they can be pushed more aggressively, and some of those fringe benefits can be extremely enticing. The problem is that once you're enrolled in a Medicare Advantage plan, it can be difficult to switch back to original Medicare with a Medicare Supplement plan. So in today's video, we're going to compare and contrast Medicare Supplement plans versus Medicare Advantage plans, discuss the pros and cons of each, and of course, get into the nitty-gritty when it comes to the costs. Now, original Medicare really does offer truly comprehensive coverage, but there are some financial gaps. Namely, there are deductibles and copays and coinsurance, and of course, there is no out-of-pocket maximum.
So this is the breakdown of Part A costs, which can be found on Medicare.gov. So your premium for Part A. Now, for most people, there is no premium. This is because your Part A premium is determined by yours or your spouse's work history. So if you or your spouse have worked long enough to qualify, that's 40 quarters, which is about 10 years, then you will not have a premium for Part A. If you don't qualify for Part A, then I have to be honest, the premium is really, really expensive. So in 2025, it's $285 if you or your spouse have worked between 30 to 39 quarters. Remember, once you get up to that 40 quarters, the premium drops off. If you've worked less than 30 quarters, then it's actually $518. This is, of course, an increase from 2024. In 2024, it was either $278 or $505. Then there is the deductible. Now, this is applied per benefit period, which is very, very confusing. Basically, you can think of benefit periods more akin to a hospital stay versus on an annual basis. So if you have to be hospitalized in February for a knee surgery, then you would have to first meet your deductible before your insurance begins to contribute to the cost share. So in 2025, that deductible is $1,676 as opposed to $1,632 in 2024. Let's say later in the year, let's say September, so we're still in the same calendar year, you have to again be hospitalized either for the same thing or a different thing. You would once again have to meet that deductible. And this is one of the reasons that Medicare supplement plans, also known as Medigap plans, are so very helpful because those deductibles are pretty high. And then there's the actual coinsurance or copays once you've been admitted to the hospital and you've met your deductible. So for days 1 through 60, it was $0 in 2024, $0 in 2025. Now, per day, if you need to be hospitalized more than 60 days, in 2025, it's $419 per day, $408 in 2024. For days 91 through 150, it will be $838 per day, up from $816 in 2024. And of course, after 150 days, you pay all costs. That has not changed. Now, if you need to recover after being in inpatient care in a hospital and at a skilled nursing facility, then for days 1 through 20, it's $0. Days 21 through 100, $204 in 2024, $209.50 in 2025, and more than 101 days, you pay all costs. Again, these copays are why Medicare supplement plans are so important because usually they will cover all of these copays. Home health care, these amounts have not changed. 0 for home health care services, 20% for durable medical equipment, and hospice care, $0 for covered hospice services. Now with Medicare Part B, there's always a premium, but that's not really that we can talk about when comparing costs. And there is a deductible. Now, unlike Part A, the deductible is applied once annually, and in 2025, it's $257. So again, that's not the biggest cost to take into consideration. Where the bigger costs with Medicare Part B come into play are those coinsurance. And generally speaking, for Medicare Part B services, we're looking at a 20% coinsurance. So a 20% coinsurance for something like a visit to your doctor is not really that significant. However, a 20% coinsurance for something like chemotherapy certainly could be. A 20% coinsurance for outpatient hospital care certainly could be. So these are the larger out-of-pocket costs that you need to be aware of when looking at original Medicare. That Part A deductible, some of those coinsurances if you stay in inpatient care or skilled nursing facility for more of an extended stay, and then that 20% coinsurance for some of the larger, more expensive services covered by Medicare Part B. And again, no out-of-pocket maximum, so if you do have major medical needs needs, those bills can really begin to stack up.
Additionally, as you've noticed, Original Medicare does not offer several key benefits, such as dental, vision, hearing, and prescription drugs. Now, a brief pause here. As I've said, Medicare is complicated, but luckily you do not have to go it alone. If you have any questions whatsoever, you can reach us in the comments below or at the number on the screen. We're licensed health insurance brokers, and we're licensed nationwide with absolutely no charge for our services. And we do release these videos on a weekly basis, so please make sure to subscribe, and of course, make sure to like this video so we can get this information out there. All right, let's get back to it. Now, truthfully, in an ideal world, 9 times out of 10, we would recommend a Medigap plan, Medicare supplement plan. It gives you the ultimate flexibility and control over your health care. There are no networks, no referrals to see specialists, no pre-authorization, and you can pretty much see any doctor who accepts Original Medicare, and almost all do. These are the major drawbacks with Medicare Advantage. But how do those costs compare?
So in all honesty, it is very, very difficult to compare costs for Medicare supplement plans and Medicare Advantage plans. In all honesty, it's difficult to compare costs amongst Medicare supplement plans themselves. Now, if you don't have any of this information in, so I'm going to clear this form, you're going to see that these price ranges are extremely broad. So I'm going to put in a little bit of information. Now, this information would not be needed for a Medicare Advantage plan. There is never any medical underwriting, and they can't charge you more based on your age or anything like that. However, something that is very important, of course, is the area in which you live. So I will put in the same zip code when we look at Medicare Advantage plans, because that is something that is taken into consideration, the plans that are available and the pricing based upon your area. Now, it'll say 12 Medigap plans, but it's really 10 plus 2 high deductible versions. There are those plans available. However, for the purposes of this video, and quite frankly, in general, we're going to ignore several of these plans because not all of them are great options. And not all of them are available to new enrollees. For example, Plan C is no longer available to new enrollees. Neither is Plan F. So the plans that I want to focus on are Plan G, the high deductible version of Plan G. Plans K and L are cost-sharing plans, but in all honesty, very often when you compare them to the high deductible version of Plan G, very often the high deductible version comes out on top anyway, so let's cross them off the list for today's video. And we're going to scroll down to Plan N as well. And these plans are very similar. So the monthly premium price range for Plan N ranges between $75 to $302. For Plan G, it's between $85 to $349. Now, Plan G is going to be the easiest to understand and cost compare when it comes to Medicare Advantage, because basically, Plan G is going to take care of all of your additional out-of-pocket costs, those costs that we discussed at the beginning of the video, with the exception of that Part B deductible. So you multiply whatever your Plan G monthly premium is by 12 months in a year, plus the Part B deductible, and those are your full costs for the year. That's really it. Now, Plan G high deductible, a little bit trickier because that deductible is much higher. However, some services are covered prior to meeting that deductible. So basically, what you can do is set a range for the Plan G high deductible, and that would be 12 times your monthly premium. And that could be plus the deductible, that could be the lowest amount you pay, but you could pay up to that $2,800 because after that, really, again, Plan G is going to cover pretty much everything. So that's, even though it says deductible, it's really sort of like an out-of-pocket maximum. And then there is Plan N, which right now we're seeing a range between $75 to $302. Plan N is very, very similar to Plan G. It doesn't cover that Part B deductible. It doesn't cover Part B excess charges. Basically, if a doctor chooses to contract with Medicare, they must accept the amount that Medicare approves, except they can choose to charge up to 15% more. When you are calculating your plans, I really wouldn't take this that much into consideration because Part B excess charges are not very common and they're not even allowed in all places. And then sometimes there are $20 or $50 copays. So that's not a huge chunk of change when we're talking about comparing costs. So that should give you a basic idea. So Medigap plans, at least the ones that we are talking about, basically, it's going to be your monthly premium times 12 plus that Part B deductible or the high deductible in the case of the Plan G high deductible version. And those are really your costs for the year. It's going to cover all the remaining out-of-pocket costs. So that Part A deductible, regardless of how many benefit periods, all your copays and coinsurance for skilled nursing facility, for ambulatory services, for chemotherapy, etc. These are all covered. However, there are some gaps. For example, prescription drugs are not covered. Additionally, things like dental, vision, and hearing are. So we are not going to compare those for the purposes of today's video. So that should give you a pretty good idea. Now let's go over and see what Medicare Advantage plans might cost. Okay, so you'll see here, I put in the exact same zip code. You're going to see that there's no information at the top indicating my age or gender. That's because those are not taken into consideration when looking at prices for Medicare Advantage plans. It did also ask me about prescription drugs. I didn't enter that information because we're trying to compare apples to apples here. And as I said, Medicare supplement plans do not offer prescription drug coverage. However, many Medicare Advantage plans do. So take a look here. This first plan has no monthly premium, and the in-network out-of-pocket maximum is $3,900. So if we were to do a direct comparison to something like, let's say, Plan G. So we had that $85 monthly premium times 12. So basically we're looking at $1,020 plus the deductible in 2025 is $257. So those would be our total costs for the year, $1,277 for all of our medical needs. It can't really be more than that because remember, as long as your doctor accepts original Medicare, and almost all do, they accept your Medicare supplement plan. So there are no additional copays, there's no networks, there's no in and out of network. This is going to be your cost for the year. Now, with this particular Medicare Advantage plan, then it could be $0 basically because you don't have to pay anything in addition to that $185 standard Part B premium, which of course you would need to continue to pay, and you would need to pay in addition to your Medigap premium. And then the out-of-pocket maximum is $3,900. So it could be anywhere from nothing on an additional monthly basis up to $3,900, and then your plan would take over for the remaining covered in-network services. So when you're comparing apples to apples, it looks like this plan could save you money if you are healthier and don't need extensive medical coverage. And that's really the thing between Medicare Advantage plans versus Medicare supplement plans in general. If you are someone who doesn't really need to utilize your health insurance frequently, then Medicare Advantage plans could save you a lot of money. If you're someone who does need to utilize your insurance more frequently, then Medicare supplement plans are definitely going to save you a lot of money. The issue is you can't just start out easily in a Medicare Advantage plan and then wait until your health needs become more extensive and then easily make the switch to Medicare supplement plans. Because should you choose to enroll outside of the initial 6-month window after you turn 65 and enroll in Medicare Part B, then you may be subject to medical underwriting, which means you could be charged more, much higher than these prices, or you could be denied completely. That's, of course, not the case with Medicare Advantage plans. So you can't just start out with the less expensive plan and switch at a later date, unless you're in one of the states that has guaranteed issue year-round at any point. Now, you also need to take into consideration that, as I said, of course, many Medicare Advantage plans offer prescription drug coverage. That is also very important because that's also not included with Medicare supplement plans. However, there are many Medicare Part D plans that are available rather inexpensively. So if you're someone who has more basic prescription drug needs, there are even often plans that have no additional monthly premium. So that could be an additional cost to take into consideration, or possibly not. So you can understand why I say it's very difficult to compare Medicare supplement plans versus Medicare Advantage plans. There are these additional benefits that Medicare Advantage plans offer. However, there are networks to take into consideration. There's issues of pre-authorization, etc. So really the best thing to do is to speak with a broker, go through your specific needs, your location, your budget, and then you can compare the best possible Medicare Advantage plans available to you to the best possible Medicare supplement plans available to you. So that way you can really sort of narrow down and cost compare. In general, you can think of it like this. Medicare supplement plans, you'll definitely pay more upfront, but if you actually need to use your insurance, you're golden. You will have very limited copays and coinsurance. Medicare Advantage plans, in general, you will pay much less upfront. Now, of course, we're looking at the plans with no additional monthly premium. There are plans that have additional monthly premiums, but in general, you will pay much less on a monthly basis. However, when you actually use your insurance, you may pay much more. And additionally, there may be such severe restrictions in your plan that you may have to go out of network or not have your services covered at all.
Now, if you'd like to learn more about the Medicare annual enrollment period, then I highly recommend you check out this video over here to see what's available for 2025. If you'd like to learn more about Medicare in general, make sure to check out our Medicare playlist. Now, before you go, please make sure to like and subscribe, and make sure to leave us a comment in the comments below. You can reach us there or at the number on the screen with any questions. As I said earlier, we are licensed nationwide, and there's absolutely no charge for our services. As always, thank you so much for watching and have a wonderful day. Bye-bye.